Venipuncture is the process of obtaining intravenous access for the purpose of venous blood sampling, also called phlebotomy or intravenous therapy. In this video, we will demonstrate the steps in performing a successful venipuncture. Here are the materials needed in performing venipuncture. 1. 5 cc or 10 cc syringes, or a two-way needle with adapter and blood collection tubes containing additives specific for the test desired. 2. Tourniquet. 3. 70% isopropyl alcohol. 4. Gauze or cotton balls. 5. Surgical tape. 6. Bins for sharps and infectious wastes. Here are the steps in performing venipuncture. Approach the patient in a friendly, calm manner. Provide for their comfort as much as possible and gain the patient's cooperation. Identify the patient correctly. Properly fill out appropriate requisition forms indicating the test's order. Verify the patient's condition. Fasting, dietary restrictions, medications, timing, and medical treatment are all of concern and should be noted on the lab requisition. Check for any allergies to antiseptics, adhesives, or latex by observing for armbands or by asking the patient. Position the patient. The patient should either sit in a chair, lie down, or sit up in bed. Hyperext in the patient's arm. Apply the tourniquet 3 to 4 inches above the selected puncture site. Do not place too tightly or leave on more than 2 minutes, and no more than a minute to avoid increasing risk for hemoconcentration. Wait 2 minutes before reapplying the tourniquet. The patient should make a fist without pumping the hand. Select the venipuncture site. Palpate and trace the path of veins with the index finger. Arteries pulsate, are most elastic, and have a thick wall. Thrombosed veins lack resilience, feel cord-like, and roll easily. If superficial veins are not readily apparent, you can force blood into the vein by massaging the arm from wrist to elbow. Tap the site with index and second finger, apply a warm, damp washcloth to the site for 5 minutes, or lower the extremity over the bedside to allow the veins to fill. The larger and fuller median cubital and cephalic veins of the arm are used most frequently. The basilic vein on the dorsum of the arm or dorsal hand veins are also acceptable for venipuncture. Foot veins are a last resort because of the higher probability of complications. Once the site is selected, prepare the patient's arm using an alcohol prep. Cleanse in a circular fashion, beginning at the site and working outward. Allow to air dry. Grasp the patient's arm firmly using your thumb to draw the skin taut and anchor the vein. The needle should form a 15 to 30 degree angle with the surface of the arm. Swiftly insert the needle through the skin and into the lumen of the vein. Avoid trauma and excessive probing. If using a syringe, gently pull the plunger until the appropriate amount of blood is drawn. If using a two-way needle, gently push the tubes in the adapter and withdraw if filled with the proper amount. When the last tube to be drawn is filling, remove the tourniquet. Remove the needle from the patient's arm using a swift backward motion. Press down on the gauze once the needle is out of the arm, applying adequate pressure to avoid formation of a hematoma. Dispose of contaminated materials in designated containers. Mix and label all appropriate tubes at the patient bedside. Deliver specimens promptly to the laboratory.